everybody, so today is Monday, July 20th, and I just got back from my OB appointment with my new gyno slash OB. Most of you that follow me have followed my videos, and you know that I have been anticipating or been anxious about this appointment coming up, and I just have a lot of anxiety about I've had bad doctors and I've had good doctors, and sometimes the good doctors are kind of hard to come by, and not everybody wants to get on the same page as you. So I was very anxious, very concerned. I was up all night last night. I've been thinking about it for days, and just worried that they won't take me seriously or they won't want to go down the same path as me. But I just wanted to stop in and give you an update on how the whole appointment went, what our game plan is, what's going to be happening in the next couple of weeks, and well, it's all fresh in my mind. And then later this week I'll do an actual like TTC related update with, you know, cycle information and testing information and all that. I went into my appointment and he came in, well, they get all your information when you're a new patient, gave him all my information, and then I went into the office and they, you know, got more information from me. And then about 20 minutes later the doctor came in and he, you know, basically let me be in control of the entire appointment. You know, he asked me why I was there and what I wanted, and, you know, specifically. And so I kind of gave him my whole background, told him everything from the time I got married until now and what I've been doing, and he was taking notes the whole time. And so his first plan was that he wanted to put me on metformin, which, you know, a year and a half, 2 years ago, I would have been ecstatic about that, because I thought that that should have been the first step that I took in this whole TTC process, was taking the metformin and then taking Clomid and then Femara and then going on and on and on and doing all that testing. But the reason why I wasn't too excited about it today was because I kind of feel like it's a step back. I feel like that's first step type of medication, you know, and I am doing a ketogenic diet to help with my insulin resistance and my PCOS. So the issues that stem from the insulin resistance and PCOS are being controlled by my ketogenic diet and the reduction of carbs and sugars and all of that. So I was very confused about what it's going to do to my body, what it's going to do to my insulin levels, how it's going to affect my diet, and whether or not if it's even going to be effective because I'm doing keto. And then I've also heard that there's a lot of really bad side effects, you know, nausea, diarrhea, all kinds of, you know, digestive, intestinal type of issues. So we talked about that for a short time. And then he basically just stopped and said, what do you want to do? What do you want to do as the next step? And we'll do that. And I said, well, I don't feel like I've had an adequate amount of testing. I've had some blood work done. I've never had a progesterone test. I've never had a single doctor that I've been seeing in the past 3 years say, hey, let's see if you ovulated. I've never had a single one monitor my cycle with either blood work or ultrasound to see if I actually am ovulating. And I told him, I said, you know, I did Clomid and they didn't monitor me. I don't even know if it worked or not. And he's like, yeah, he's like, I definitely would have monitored you with the Clomid, etc., etc. He said, but, you know, if you are ovulating, there's like an 85% chance that with as many rounds that I did that I should have ended up pregnant. So going forward, so he suggested that I get my progesterone drawn today because I'm only cycle day 23, so they can check that to see if I ovulated this cycle. And then he wanted to have an ultrasound done of, you know, my pelvic area, uterus, ovaries, fallopian tubes, you know, ultrasound, all that, make sure there's nothing obviously wrong, which I've had so many ultrasounds in the past year that I'm not too worried about that test. And then he said if my insurance will cover it, if I want to, and I brought this up, he didn't, about getting the HSG test where they inject the dye and the saline into your tubes to see if they're clogged. I said, you know, I'm kind of at the point where, you know, I've taken the herbal supplements and I've, you know, taken the Clomid and I've had my blood drawn for, you know, thyroid and hormone levels and sugar levels, and I've done all these things and I'm losing weight. I feel like there's got to be something specific that is preventing me from getting pregnant. You know, my husband, all his tests were perfect, so something is, you know, there, you know, something is happening. And so he said, you know, I think with you getting pregnant before that, the HSG test is not completely necessary, but if it's something that you want to do, then we'll do it, which I'm kind of afraid to get it done because I've heard of it, it's painful. But, and then the other part of that is that I don't know if my insurance will cover it, and it's like a $2,000 test. So if they don't cover it, I'm just not going to do it if he's not wanting me to. But if they do, then he said as soon as my cycle starts within this week, then give them a call, and then within 9 days I'll be going and having the HSG test. So we've got ultrasound, blood work, HSG. If all of this come back normal, don't show any signs of any issues, then he wanted to put me on metformin for a few months and give that a go. Then he wanted to do a pelvic exam just to check the stuff out. So I sit in the room for like 30 minutes waiting for them to come into the pelvic exam. And something that I don't know if I've ever spoke to you guys about, but since I first started trying to conceive, I have been having an issue with my cervix. And TMI alert for anybody that's watching this, because it's going to get kind of icky. I've been having an issue where my cervix is very, very low to the point that it hangs out of my body. Sometimes it rubs on my underwear, and it's more specifically or more extreme when I've been on my feet all day, or if I've been sitting on the toilet, it will come almost it feels like it's almost come completely out of my body. And I've been having this issue for a couple of years now. Now, when I had my miscarriage, I brought it up to the doctor that was seeing me for the miscarriage, and he did an exam, and he said, I don't really see anything wrong. You know, if you have a low cervix, that's not an issue. Actually, it should help you get pregnant faster because your cervix is closer to where the sperm is going. So I was like, okay, I wasn't worried about it. Well, it kept bothering me, and it's concerning. You don't want to see that. You don't want that to happen. So when I went to my new gyno in Maine, same thing. Wasn't concerned, didn't see anything wrong. When I went to the other gyno in California, told her about it, wasn't concerned. Then I go to him, and before he does the pelvic exam, I said, you know, I've been having this issue with my cervix. Everyone keeps brushing it off, but I wanted just for you to know about it. So he does a more extensive type of pelvic exam where he like took the little speculum thing apart, and he had me like bear down and like almost like I was pushing. And he's like, yeah. He's like, you have an issue here. He's like, you have secondary uterine prolapse. And this could definitely be the reason why you're not getting pregnant. It may not be 100% why you're not getting pregnant. There, of course, could be underlying issues. But for your cervix to be so low and protruding out of your body, you know, almost all the time, he said, there's no way that sperm can live and make it to where it needs to go. He's like, yeah, if you had a slightly longer or low cervix from where your cervix is supposed to be, of course, you know, that might aid in conception. But if you have sex and then your cervix just drops back down, pushes all the semen out, and all the semen that is on the cervix, instead of being up there where it needs to be moist and warm or whatever, and having the opportunity to be in there for hours at a time or even days to, you know, get you pregnant, he's like, if it comes out of your body, all the sperm's going to dry up and die. You're not going to get pregnant. He's like, I really wholeheartedly believe that this could be the reason why you have not got pregnant. So he said, I'm going to fit you for a diaphragm. That's what they did. They fitted me for the diaphragm. So now what he wants me to do is have the progesterone test. He wants me to use the diaphragm, get the HSG, and the ultrasound. If all of the testing prior to, if all the testing comes out okay, then what's going to happen is I'm going to use the diaphragm and the metformin for a few months and see how that goes. And, you know, just kind of go from there. So I don't want this video to go on, and if it goes past 10 minutes and I have to edit stuff, and I feel like everything I said was important and I don't want to have to start cutting things out. So that's the game plan for now. In a couple of days I'm going to have a TTC update for you, what's going on my whole cycle, and Also to note, he was ecstatic about my weight loss. He wasn't quite sure what the ketogenic diet was, what keto was, so he didn't give me a bunch of crap about it being bad for me or anything like that. He said he even thinks that with such dramatic weight loss and doing so well with my weight loss so quickly, he thinks that that and the diaphragm could get me pregnant within a few months. So we'll see. Thank you so much for watching, and if you have any questions, leave them down below.